right. Well, good morning, everyone. We are going to get started in a few moments. Terry, do you want to go ahead and load your slideshow so we have that ready?
Good morning, LACERS members. My name is Terry Macias. I will be talking about LACERS medical plan eligibility, LACERS Medicare requirements, and senior medical plan options. If you need one-on-one counseling for Medicare, please contact lacers.health@lacers.org or call our 1-800-779-8328 member services. So just a note for our active members, this presentation is designed for retired members approaching Medicare age. Members who are still working for the city of Los Angeles do not have to apply for Medicare until they retire. Active health benefits are provided by employee benefits. And please be sure to contact LACERS if you are of Medicare age at the time of retirement. So to be eligible to enroll in LACER sponsored medical plan, you must be a city retiree or an eligible surviving spouse domestic partner and receive a monthly retirement allowance or continuance from LACERS. According to LACERS board rules, when you or any dependent turns age 65, you are required to enroll in Medicare Part B and maintain coverage, enroll in Medicare Part A only if you are entitled to it premium free. So what is Part A? Part A is hospital insurance. You may receive premium-free Medicare Part A based on your contributions history with Social Security and Federal Insurance Contributions Act, or other ways known as FICA. If you started with the city after April 1st, 1986, by paying FICA Medicare payroll taxes, through your spouse when they reach age 62, if they are eligible for Medicare Part A premium-free. Now, what is Part B? Medicare Part B helps cover medical services like doctor's services, outpatient care, and other medical services Part A doesn't cover. If you don't sign up for Part B when you're first eligible, you may have to pay a late enrollment penalty. So the cost of what you will pay for Part B is based on your income from 2 years ago. So for example, if your yearly income in 2020 was $91,000 or less, filing your taxes as an individual, your monthly premium for Medicare Part B will be $170.10. Now, let's say that you are filing your tax return jointly and you make above $228,000 up to $284,000, then you will pay each month $340.20, and that will be for year 2022. So the monthly basic premium rate for Medicare Part B is $170.10. You may be billed quarterly or receive a monthly deduction from your Social Security Administration benefit, and that's if you get one. What is Medicare Easy Pay? Medicare Easy Pay is a payment option for your Medicare Part B and D premiums. It's a monthly automatic electronic deduction from your savings or checking account. It will assist you in making Medicare premium payments on time and regularly, and it is a free service. If you receive a Social Security check and your Medicare Part B premium is deducted from it, then you do not need to participate in the Medicare Easy Pay plan. You are responsible for paying your Medicare premiums to Medicare directly. Medicare will bill you directly on a quarterly basis. If you receive a Social Security check, the premiums will be deducted from it on a monthly basis. LACERS does not process your Medicare payments, and LACERS cannot directly pay your Medicare premium from your LACERS monthly allowance. LACERS will reimburse you your Medicare Part B basic premium if you are a city retiree, enrolled in Medicare Parts A and B, eligible for a medical subsidy, and enrolled in a senior medical plan or participating in the medical premium reimbursement program, which we will talk about a little later. Dependents, spouses, domestic partners, and survivors are not reimbursed. It is recommended that you enroll in Medicare 3 months before turning age 65 and no later than 3 months after the month you turn 65. The effective date of your Medicare will be determined based on the month you applied to Medicare. So here's a chart of when to enroll in Medicare. So if you enroll 3 months, 2 months, or 1 month before your birth month, then your Medicare will be effective on the first date of your birth month. If you enroll on your birth month, then you will be effective 1 month after your birth month. Now, if you enroll 1 month, 2 months, or 3 months after your birth month, then your effective date might be delayed anywhere from 3 to 6 months after your birth month. And this is what is acceptable proof of Medicare. So acceptable proof of Medicare is your Medicare card, the Social Security entitlement letter, and a Social Security benefit verification letter. The Social Security entitlement letter should have your Medicare beneficiary identifier and the effective dates for Part B or Part A and B. The benefit verification letter, also called proof of award letter, that letter can also serve as proof of your Medicare benefits. Once you turn 65 and acquire your Medicare, these are the documents to submit to LACERS. Your Medicare proof, your senior medical plan application, LACERS senior medical plan enrollment form. Can I have more than one senior medical insurance plan? No, you cannot. You may only assign your Medicare to one medical plan at a time, according to the Centers for Medicare and Medicaid Services. If you enroll in another senior plan other than LACERS sponsored medical plans, your LACERS medical plan will be terminated. So prescription benefits, also known as Medicare Part D, is the Medicare prescription drug benefit, which is already included in the LACERS senior medical plans. Be very cautious of other senior medical plan advertisement like mail, television, radio, and social media. If you enroll into an individual senior medical plan or prescription plan, your LACERS senior medical plan will be terminated. How do you re-enroll in Medicare Part B once it lapses? So if there is a lapse in your Part B coverage, please contact Social Security Administration regarding your Medicare lapse and request a reinstatement. You can also contact the Center for Healthcare Rights at 1-800-824-0780. And then once your Medicare Part B has been reinstated, please contact LACERS immediately. So Medicare will impose a 10% premium penalty for late enrollment for each 12-month period. The penalties will exist if you are enrolled in Medicare Part B. In most cases, you will have to pay this penalty each time you pay your premiums for as long as you have Part B. Lasers does not reimburse you for these penalties. What happens if you fail to pay your Medicare Part B premiums? Your Medicare Part B will be terminated by the Center for Medicare and Medicaid Services. You and your dependents' Lasers medical plan will be terminated. You will no longer be eligible for medical subsidy, and your Medicare Part B reimbursement will be terminated too. If you do not enroll in Medicare or do not pay the premium, you will no longer be eligible for a Lasers medical subsidy. Your Lasers senior medical plan coverage and that of your dependents will be terminated. The Centers for Medicare and Medicaid Services will alert your medical plan, and your medical plan will notify Lasers of your Medicare lapse. So this is a story on a member who has lapsed on their Medicare Part B coverage. Martha is a city retiree, age 67, and enrolled in the Lasers senior medical plan. Martha was not eligible for Social Security monthly allowance, so Martha writes a check each quarter to pay the Medicare Part B premiums directly to the Center for Medicare and Medicaid Services. In December 2021, Martha thinks Medicare Part B is too expensive, even though Lasers reimburses the member. She decides not to send in the first quarterly payment for 2022 to CMS. In January of 2022, Medicare informs Lasers senior medical plan that members' Medicare Part B coverage is no longer active. The Lasers senior medical plan then informs Lasers and Martha that the senior medical plan coverage is terminated as of January 1st. Martha takes no action and does not respond to Lasers or the senior medical plan. Lasers mails Martha the final notification of the Medicare Part B lapse and plan cancellation in January. Again, Martha ignores the notification and does not respond. In April 2022, Martha tries to schedule a doctor's appointment. The doctor's office informs Martha that coverage ended as of January 1st. Martha now calls Lasers to find out why the medical plan was canceled. Lasers informs the member it is because the Medicare Part B coverage lapsed. Member then contacts Social Security Administration to try to get back into Medicare Part B, but was told that the Medicare General Enrollment period has passed. The Medicare General Enrollment period is between January 1st through March 31st each year. The member now must wait until January 2023 to enroll back into Medicare, and Martha's Medicare coverage will be effective on July 1st, 2023, if the Medicare Part B premiums and any penalties are paid. In January 2023, the member was finally able to enroll in a Lasers senior medical plan effective July 1st, 2023. Martha must provide Lasers proof of coverage within 30 days of the Medicare effective date. Failure to submit all the required documents by July 1st, 2023 may result in the member having to wait until January 2024 to enroll in a Lasers senior medical plan. Because the member let Medicare Part B lapse, Martha was without Lasers medical coverage from January 1st, 2022 until July 1st, 2023. That's a year and a half with no medical coverage, without Lasers medical coverage. Martha could have avoided this situation by responding to the letters that Medicare, the medical plan, and Lasers sent, and taking action to reestablish Medicare Part B immediately. Keep in mind, if your LACER senior medical plan is ever canceled due to a Medicare Part B lapse, you must reestablish your Medicare Part B coverage prior to re-enrolling in a LACER senior medical plan. You will have 30 days from your new Medicare Part B effective date to enroll in a LACER senior medical plan. Going forward, Martha may be subject to a lifetime of penalties from Medicare. So now we're going to talk about the income-related monthly adjustment amount. Depending on your income, you might pay more for your Medicare Part B and drug coverage if your income is above a certain limit. You'll pay an extra amount in addition to your plan premium. For example, if you are single and your modified adjusted gross income is more than $91,000 per year, or if you are married and file taxes jointly and your modified adjusted gross income is more than $182,000, you may be charged additional premiums for Medicare Parts B and D. You are responsible for paying these additional amounts to remain eligible for your LACER senior medical plan subsidy and Medicare Part B reimbursement. You are required to pay your IRMAs even if your third party pays for your prescription premiums. The Internal Revenue Services reports your income tax for a particular tax year to CMS to determine your IRMAs. The income tax year which determines these fees is from your tax filing 2 years ago in 2020 for the year 2022. LACERS does not reimburse the additional premiums. Now I'm going to talk about the LACER senior medical plans. So senior medical plan options for members who have both Medicare Parts A and B are Anthem Blue Cross Medicare Preferred PPO, Kaiser Permanente Senior Advantage HMO, which is only available in California, SCAN Health Plan, which is also available in California only, United Healthcare HMO, which is available in California, Nevada, and Arizona. Please take note that you must live within the plan's zip code service area. If you are entitled to Medicare Part B only, your choices are as follows: Anthem Blue Cross PPO, Anthem Blue Cross HMO, which is available in California only, Kaiser Permanente Senior Advantage HMO, which again is only available in California. What is dual care? Dual care household is an option when one member of the household is age 65 or older with Medicare Parts A and B, and another member of the household is under the age of 65 or 65 and older with Medicare Part B only. For retired members with Medicare Part A and B and a dependent not in Medicare, your choices are Anthem Blue Cross Medicare Preferred PPO with Anthem Blue Cross PPO, Kaiser Senior Advantage HMO with Kaiser HMO, SCAN HMO with Anthem Blue Cross HMO, and United Healthcare HMO with Anthem Blue Cross HMO. Meaning that if the member with Medicare A and B, they would have to enroll into the Anthem Blue Cross Medicare Preferred PPO, and the dependent would have to enroll into the Anthem Blue Cross PPO. Now we're going to talk about the Medical Premium Reimbursement Program. The MPRP program is a medical plan option for retirees or survivors who reside outside of California or in California, but outside a LACER's HMO authorized zip code service area. The medical premium reimbursement program is not available outside the US and its territories. Now, if you are Medicare eligible and you would like to participate in the medical premium reimbursement program, you must enroll in a senior medical plan. You will be reimbursed for the Medicare Part B basic premium, supplemental Medicare Part D prescription drug coverage premium, and the vision insurance premium. If you plan on permanently residing outside the United States and its territories, you do not need to enroll in Medicare. Retirees who reside outside of the US coverage area can only enroll in the Anthem Blue Cross out of the country plan. Medicare is a federally funded program. The Center for Medicare and Medicaid Services may charge you penalties if you return to the US to reside and need to re-enroll in Medicare. Please contact your Social Security Administration for more details. For additional information, you can contact Social Security Administration at 1-800-772-1213. They also have a website at www.ssa.gov. You can contact them at Centers for Medicare and Medicaid Services. And the number is 1-800-633-4227. Their website is www.medicare.gov. And you can also contact the Center for Healthcare Rights at 1-800-824-0780. Thank you so much for participating in the presentation for Medicare and You.
All right, thank you, Terry. So that concludes the formal portion of the presentation. Just by looking at some of the questions that have come through already, I just want to clear up, for those of you who are still actively working for the city, you do not need to enroll into Medicare until you are ready to retire, and you will enroll during once you start the retirement process with LACERS. So if you're 65 or older or approaching 65 and you're still planning to keep working for the city, do not worry, you do not need to apply for Medicare right now. You will do that during the retirement process. Now, some of you may actually qualify for Part A of Medicare for free as an actively working member, and sometimes Social Security actually just automatically enrolls you into that. Don't worry, you're okay to have Medicare Part A if it's free to you while you're still working. Just make sure you're not enrolling in Medicare Part B, because that does not work with your active health benefits, nor will it do you any use to pay those premiums, and you don't get anything out of it. So I just want to clear that up so there's no confusion. And I also want to give you guys an opportunity to go ahead and submit any remaining questions you have about Medicare. Again, general questions, nothing too specific and personal to you, please. But we'll go ahead and answer those, and Terry will be answering some of them out loud now. So again, now is your chance to go ahead and submit your questions and have those answered while we do have health staff available. So let's see what questions we have. So Terry, we have a question from Tran, and she is asking, can you explain further the basic premium reimbursement?
So like I mentioned during the slide, the basic premium reimbursement is what what Medicare will be, let's say, charging you for your Part B. That is the lowest amount that they will charge you. This year is $170.10. And so it all depends on your income from 2 years ago, if you're going to have to pay for the basic premium, or if you're going to pay a higher premium due again to what you made 2 years ago. But the basic premium is the lowest amount that you're going to get charged for Part B.
Got it. Thank you. And then Latanya is asking if you can repeat what you mentioned about the Medicare Part B reimbursement and how they get that.
So for members, the Part B reimbursement is offered to them when you qualify for Part A premium free. We do require that you enroll into it if you do qualify for a premium free, and enroll into Part B. So if you have both of them, then we, Lacers, will reimburse you the basic premium, which is the $170.10 on a monthly basis. Medicare will probably bill you if you're not going to get a Social Security check, they'll bill you every 3 months, but we will reimburse you every month. Now, if you have a Social Security check, then they'll deduct it on a monthly basis, and sometimes that works out a little bit better, but we reimburse Part B when you have both A and B. And again, you have to, you only get Part A when it's premium free.
Great, thank you. And we had an Elizabeth who said she missed the first part of the presentation. Can you just quickly go over what does Part B of Medicare cover?
So Part B of Medicare covers your doctor visits, and most of your, let's say if you go to a specialist, those visits, so more than anything, the doctor visits to any specialist or your primary care physician.
Okay, got it. Next question from Dan. He wants to know, how are members reimbursed? Is it once a month, or is it by direct deposit, or how can they expect to get the reimbursement if they qualify for it?
So if you do qualify for the Medicare Part B reimbursement, you will be reimbursed. It will show up as an adjustment in your monthly pension check. So you will see an increase of $170.10 on a monthly basis. So again, it's going to show up in your pension check.
We have a question from Ira. Will Social Security automatically enroll you into Medicare when you're about to turn 65?
No, they will not. You will have to contact Social Security to enroll yourself. We always ask 3 months before. That is the best amount of time that you could take to enroll. We will not enroll you either. Lacers will not enroll you into the Medicare plan either. So you have to contact them directly.
We have a question from Anachim. They're asking, what is Medicare Part D, and do I need it, and will I be reimbursed by Lacers for it?
So Medicare Part D is your prescription drug, and you do not need to enroll into it separately. When you retire and you submit your health enrollment forms, and you select your plan that you want to be covered with under, the Part D is included in the plan. So once you enroll with us and you fill out all the information, you are being enrolled into Part D, so you don't have to enroll separately.
Great, thank you. I'm seeing a few different questions about, members are still working after 65. They're asking if they need to enroll in Medicare. And again, I want to stress that you do not need to enroll in Medicare, even if you're 65 and older, if you're still working for the city and you have coverage through the city medical benefits. So if those two criteria apply to you, you're over 65, you're still working, and you have coverage through the city, that is correct. You do not need to enroll in Medicare until you are ready to retire. The same can be said about a spouse. So for example, if you're still working and your spouse is the one that's going to be turning 65 soon, they too do not need to enroll in Medicare until you, the LACERS member, is going to retire. At that time, they will enroll. But they do have to be covered under your city medical plan. So that is the important distinction. So if your spouse is over 65 or 65, there's nothing they need to do if they're covered under your insurance with the city. Oh, okay. So this one's a good question. So are you going to help fill out the Medicare forms when you, for example, during the retirement process, what can members expect in terms of getting assistance with filling out, forms, the senior forms and anything Medicare related?
We can definitely help you with your health enrollment forms. We can guide you through the health enrollment forms. Now, when it comes to Medicare, if you are retiring after the age of 65, what LACERS does is that we will provide you with a employment verification form, also known as CMS L564 or the SEP form. That form comes with information for Medicare showing that you have been covered through your employer past the age of 65 to avoid any late penalties for enrolling after 65. But we do not help with filling out Medicare forms.
So we are quickly approaching the 12 o'clock hour, and I know there are so many great questions left in the chat that are unanswered. Based on the high interest in Medicare as a topic, it's very likely, in the future, we'll be able to hold another one of these that you can participate in the future. So stay tuned for that. We do also have another Q&A session next month, specifically about the medical premium reimbursement program. So if any of you are thinking about moving out of state after retirement, or you already have moved out of state and you're retired, and you want more information on this program that allows you to enroll in an HMO outside of the LACERS basic plans in that state, I highly recommend that you go ahead and sign up for that. You sign up the same way you signed up for this presentation, either through your My LACERS account or giving us a call on our 1-800 number. And with that, we are at the 12 o'clock hour. I know people want to grab some lunch and get on with their days or work days if you're at work. But I want to thank you all so much for participating in this presentation. Really look forward to hearing from you. Again, you can call us if you do need personalized assistance or have questions about Medicare. Call our 1-800 number and ask to speak with one of our health advocates. Or you can always send us an email at lacers.health@lacers.org. So on behalf of myself and our LACERS health benefit staff, thank you again for taking time to learn more about Medicare and you. Have a great rest of your day.